I don't see any hands. Right. I will say, I wanted to ask you this afternoon, we got a matrix showing, excuse me, what the surrounding districts and our component districts are doing. And it looks like Fullerton School District is starting next week. I will mention Thursday, Friday, I went by the local elementary school and the parking lot was full of cars. And I thought, oh, looks like the teachers are back. Yesterday, I was with my grandson who's in 5th grade there, and he bounded out of the house with a smile from ear to ear. And his mom said, he went to school today. And I said, how was it? He says, it was great. And I said, did your teacher miss you? And he said, yes, she did. Anyway, his attitude is just 180 from, previously when he was totally at home. So I also noticed that La Habra is going back the following week, La Habra City School District, the 2 middle schools, and I guess Rancho Starbuck, because it's in LA County, is still going to do remote learning. Also, Placentia or Belinda has been in hybrid consistently, as have Orange, Tustin, and Newport Mesa. So it looks as if many of the school districts, including those who have students that feed into our district, are going back next week or the following week. And also I would mention, in addition to the public comments, I think we all received some written comments from people. I think we had 8 from parents who were begging us to go back. We had 1 who was saying, don't go back, which reflected what we heard tonight. So, are there any other comments?
I think it's important to clarify that the teachers in Fullerton School District are being paid extra pay to be there this week. Otherwise, students who choose to be on campus are being supervised by classified staff. School is not in session there this week. It's optional, and like I said, the teachers who are there, my understanding is they're being paid an extra stipend to be there. So I just want to make that really clear as we head into this conversation that school is not open in Fullerton.
It's going hybrid on next week,
right?
Lauren.
But it's not open this week, and the teachers who are there this week are being paid extra to be there.
Yeah, I believe that they're getting paid $300 per week.
They are.
Yeah.
Another minor clarification is that Newport Mesa returned yesterday, so they had been in distance.
Well, I'm not seeing any conversation, which led to a feeling of consensus at the last meeting that we had. At the last meeting, the consensus was that we were going to go to hybrid next week. So I'm not getting a sense that there's a change in that consensus.
I am ambivalent about the situation. I am so grateful to see the trends improving and improving dramatically, and not just a blip, but a trend. I've been trying to compare. You can go on the county's dashboard, and it's daily, so you can kind of then, like, where are we now, and then go back in time and see where we are. So it's very similar to where we were mid-December. So at the Thanksgiving surge, so to speak, we were seeing the Thanksgiving surge. So it's, what I mean is it's getting down to that because it spiked so much higher. I am glad that we went on distance when we did. The data unfortunately proved that that was the correct decision given what happened. And I think, I'm not sure that it was said out loud that Buena Park Junior High is returning February 2nd, the junior high school, excuse me, in the Buena Park Elementary District. Maybe it was said and I just didn't hear it, but I also wanted to give that clarification.
I meant that. You're right, Joanne.
Okay. Oh, that's okay. So I am ambivalent. I mean, on one hand, I'm definitely hearing the concerns about mental health. I'm definitely hearing the concerns about students struggling academically, and of course this is, it's always hard to determine the number of students for sure, or with any degree of certainty, who are in that situation. We do have great analysis, of course, but the social emotional part is much more difficult to determine in an aggregate basis. I am encouraged by the vaccines, and it does seem that a plan has been created, or is in the process of being created, as well as an increase in production. I think I obsessively check every hour on what's happening with that, because it's not only good for those who are 65 and older, or the next group, that helps the community overall. Often schools are compared to other workplaces or other areas where the public interacts, such as, let's say, grocery store. Those interactions are brief, and so it's not quite the same as being in a room with people for 45 minutes-ish. I'll just say 45 minutes to make it simple. So there is that difference. I am pleased with the protocols that were put in place. Like anything, those are only as good as those who are willing to follow them. And I think overall they were followed well, yet it's not 100%. And in a pandemic, less than 100% adherence to safety protocols delays our return to delays moving past the pandemic. I don't want to say return, moving past the pandemic. So I'm ambivalent about what to do. There are different ways to slice the numbers. There are different ways to apply that data. So I just want to share with the board, I'm very ambivalent about our next step.
Lauren?
A couple of concerns were brought up for me while I was listening to the public comments tonight. One of them was a report from a teacher stating that mask wearing and social distancing was not occurring on campus. And we know that that's a challenge for kids. But the fact that it sounded like it was fairly well observed concerns me. Another concern that came up for me while listening to public comments was that at least one teacher was saying that it was the first time that she had heard what part of the protocol was if a student reported to her that they were positive. And that she indicated that she had received communication from other teachers that was also the first time that they had heard that. And so the concern that comes to mind when I hear this is that protocols are not being implemented 100% across the board. And it sounds like there needs to be a serious review from the site level admin down through, all support staff on campus about what expectations are, what protocols are for safety and communication when students are reporting that they are ill. Because if we don't have a basic understanding of those at every level, then we have a really big problem returning to any type of hybrid learning. And these are the things that I heard as I was listening to the teachers who were talking tonight. So that concerns me a lot.
Vicki Calhoun.
Oh, hi. Hello. I'm still concerned about going back. I looked at the Orange County COVID-19 dashboard, and it was still high. It was when we made a decision in December, it was 12%, and it's still above that. And in my area, again, 92822 is 18%, 92823 It's 17%. Also in La Habra and Buena Park, it's 17%. So I don't see a significant change. And so I don't think it's wise for us to go back right now. I would try to give another couple of weeks. And I think the trend will continue to go down, but it's not down far enough for me.
Okay, I don't see any other comments. Dr. Jane?
No, it concerns me that we're still in purple tier, as well as at St. Jude Hospital. St. Jude Hospital has capacity for 300 beds. Currently, there are 400 patients. So there are 100 patients over already. They have canceled all the surgeries already, and they are only seeing emergencies and basically COVID. There are 2 mobile morgues sitting in their parking lot. And so there are people dying left and right. And that's the reason why they need to have mobile morgues. So all these things do concern me. I know that the governor semi-opened up California yesterday for certain like restaurants and things like that. But we're so close to having a vaccine for the teachers and the support staff that I truly believe that when the teachers and the support staff feel comfortable about going to work, it's going to help the educating our kids. It's going to make the work environment a lot more comfortable and safer. Personally, my staff and I all have received our first dosage of the vaccine already. I was basically in tier 3 of Plan 1A, and so I was in the first group to get it. And I'm getting my second dosage on February 8th. That being said, the last 2 weeks after I got vaccinated, I actually have been feeling more comfortable about going to work, not as stressed. And safety is an issue. And patients have noticed that when they go into the office, that we are actually talking to them, that we are actually comfortable in our environment, and that we're not so stressed over getting COVID or catching COVID or just even drinking water or even just moving our mask. The last 2 weeks, I've seen the difference in my own staff and in myself. And so I'm not really all that comfortable about opening school yet for these reasons. And also too is I know that, I want to thank all the parents for informing us and sending emails and even speaking tonight. But we're so close in being able to vaccinate the teachers and the support staff so that the kids can actually go to school and feel comfortable as well. So it's not just a comfort issue, it's more of a safety issue for both the students and for the support staff and teachers. And we're just so close already. And the days of the more massive vaccination is almost here.
Joanne Foley.
Thank you. Listening to my colleagues' comments, and of course, I've been looking at the data. It occurs to me we're almost like at a bit of a data crossroads. Is the trend downward going to continue? And it's never a straight line, but is the general trend going to be downward? In other words, is it going to be improving? And is the trend on the vaccines upward? At this point, no one can predict the future, but we don't have quite enough data to know for sure which way the trend looks like it's going to continue. And so I would be comfortable delaying, a few weeks. Maybe someone could suggest a date so that way we can see, all right, is this holding? Is the positive movement, for example, today when the county updated the 7-day average on the positivity rate showed a pretty significant improvement. It's still high. It's, countywide at 12.9%. But before that, I believe it's 14 something. So that's a pretty big drop. Maybe next week we'll see another big drop and then another big drop. And then we'll know that it will work. And what Chester's saying about comfort level, I understand what he's saying. It's, you can be in an environment and you're trying your best, but there's still this tension that exists. And each day after you get vaccinated, your immunity builds a little bit more. And you know that, you're not fully immune yet, but you also know that you're not at such high risk anymore. And so I would be comfortable with, maybe we could toss around a brief delay to return to hybrid so we can really determine which direction we're going in terms of the virus in the community, as well as the availability of the vaccine.
Oh, Lauren Klatzker.
I realized I was raising my hand, but it was off camera, so you couldn't see it. One of the things that I keep obsessively checking, like Joanne, is I check the county dashboard every single day. And it comes up automatically now on all of my devices when I start typing it in. That's how bad it is. And today's update was a drastic improvement. We're down to 46.6 for positive cases, and then test positivity of 12.9, which is a huge improvement over yesterday, over last week. But it's still high. If you look at the dashboard main page, one of the things it tells you is that anything over 8 is considered widespread. And it's hard for me to get away from that, because if we say anything over 8 is widespread and we're at 46, that's not great. We're hugely better off than we were before, but it's not great. And I keep coming back to that and making these decisions based off of the numbers. And when I look at all the zip codes and the numbers in the zip codes in our district, I'm also seeing that trend that Joanne was talking about, that downward trend, but we're definitely still, in some cases, actually in most of our zip codes, above the county average. And when I look at, I found where it lists cases of 15 to 18-year-olds by zip code. And it's so striking to me how much of a difference there is between what's reported by the county, which is, of course, test driven, versus what we get when we get self-reported cases. There is still so much of a stigma associated with having COVID that there's such underreporting that's happening. Situations where like one person in the family tests positive and then other people get it, but they know they have it, so they don't test. So there's so many flaws in our knowledge system as it relates to COVID that it's hard to even really get a handle on what is out there. I would be supportive of coming back, honestly, and you guys could think this is crazy, but on a weekly basis as a board to determine whether the trend is continuing in the right direction and whether we're ready to open. I don't want to delay this any longer than we need to, but everybody does need to be safe. Students need to be safe. Teachers and staff and administrators on site need to be safe. Kids, everybody needs to be safe and feel safe. And so if that means we have to come back as a board every week to review and discuss, then I'm willing to come back every week to review and discuss.
Chester J.
I agree with Lauren too. I don't have any problems coming back every single week. And as a matter of fact, I want to come back every single week because I want to make sure that the parents understand that extending the distance learning, it's not something that the board takes lightly. It's actually something that we are very concerned about. It's not more than, besides the emotional aspect of this, it's actually the health and safety aspect of everything. The students, the teachers, the support staff, even the multi-generation families that live together. Because it is true that scientifically, a child gets COVID, they're a little bit more symptom free. They go home and then they infect the parents, the grandparents. So it's not just the students. We have to look at everyone as a whole, all the families. And we have to do our part to keep the numbers low. And we're almost there. We're not that far. We're just, we're almost there with the vaccines, and we just have to hold on for a little bit. So I don't mind coming back every single week because I want to make sure that our listeners, the parents, the teachers, the support staff, everyone know that this board takes COVID very seriously and we take education very seriously. And I would be more than happy to come back every single week to discuss this so that we can switch to go back to hybrid immediately if the numbers make sense, or if the vaccines there's a vaccine date for the teachers and the support staff. It's that important to me that besides education, the overall health and safety.
I'm a little bit uncomfortable about us individually being the evaluators of the data. I would be more inclined to look at the evaluator being the medical professionals at the Orange County Department or at the state. So I'm just sharing that a little bit. I think we can all go on and evaluate the data as we see it or listen to whatever radio or newscast we listen to. Also, I think anecdotes are a little bit dangerous as well. I'm a little concerned about a comment that was made about, well, we've got this holiday coming up and we've got that holiday coming up. And I think you could even go beyond that. And there will always be a 3-day weekend or some kind of a holiday when people are going to go out and not be sensible. And then that's going to reflect upon a decision relative to our students. As far as the vaccine, I'm hearing, again, this would be anecdotal, that there is a supply issue. There's also a distribution issue. So my guess is there will not be this herd immunity until the summer. So, we can come back every week and we can debate this and we can talk about the numbers, but we're denying 50% of our students and their parents' desire to get their kids back into the classroom for mental health issues or educational issues. So, I appreciate everything that you're all saying. I think Joanne's comment about, what was it you said? We were a little bit, I forget the word you used, about, uncertain about, what was the right thing to do. And I certainly share that. But I also worry a little bit about some of the things that have been said. We don't know. We don't have a crystal ball. This morning, the elementary superintendent, and I think Vicki was there, said he thought he had a crystal ball, but it's all cracked and, not working very well these days. I think we could all say that. So I don't know if we need to look to our staff for what they're hearing, what the recommendation is. So I don't, Scott, do you have anything you'd like to say at this time? You're probably going to say you don't want to hear what I have to say, right?
You guys know how I feel. I'm for the kids, and
normally we are a leader in the right thing to do. It looks like we're going to be a follower as our other districts are biting the bullet and sending their kids back to school. So.
I'll just put it this, couple things. I know we had one teacher say that she had some issues. There's not a systemic problem when we were in distance learning. Our teachers did a very good job. All the principals reported that the kids were wearing their masks. There was distance learning. I'm sure there might have been some kids who didn't wear them or weren't wearing them properly, and they were told that's going to happen all the time. But the fact remains that our schools were safe. There were no transmissions, and that's true for all the districts because we following the protocols of distance learning. So I would hesitate greatly to say that there were issues and we were not communicating. I'll just say we're coming up on 11 months. Our kids desperately need to be back in class. We're called essential employees. We're at the top of the list for getting vaccines for a reason. So my hope is that we can get the kids back in class as soon as possible.
I'd like to ask a question. And I don't know if this information would be readily available right at this moment. And I hate to put this out here because normally I know we like to ask our questions that require data gathering in advance, but I'm wondering how quickly we could get the information of exactly by site what the numbers are, because I actually think at some sites, I've been told that it's more than 50% are opting for cohort C. And just anecdotally, I know that some people are not officially on cohort C, but are staying home anyway for learning. But I'd be very interested to know what those numbers really are by site. And again, I know I'm throwing that out there, so please feel free to tell me you can't get me that right at this second, and I totally understand. But I do kind of want to respond to something that you just said, Marilyn, and that is that normally we're a leader in doing the right thing, and now we're going to be a follower. And, you know, when you said that other superintendent said his crystal ball was cracked, nobody's got a crystal ball. It's a pandemic we've never experienced before. There is no telling, and we should not be politicizing. We should be talking about the information that is publicly available through the county and making data-driven decisions. We can't control what teachers and kids and staff do off of campus and what they bring onto campus. We can only control what we do on campus. And there does seem to be some teacher reports of not understanding some things or not being informed of some things. I don't think it hurts in the middle of a pandemic when we do return to distance learning to review very carefully with all staff members the protocols for both safety and communication when students inform a teacher or someone else on campus that they've been sick or someone in their home is sick. That's never a bad thing, and that's never going to hurt anyone. It only benefits every single person on campus to do that. So I'm not accusing anyone of not doing their job, but clearly at least one staff member reported tonight that there was a lack of information. And if there's one, all of us educators know if one kid in class has a question, there's at least one more in the class that has the same exact question. All of us educators know that. So what that tells me is if one teacher is unclear about something, there's going to be more that are unclear. So why not spend some time when we do decide to return to hybrid, reviewing all of the things that people put in so much time and effort developing to help ensure the safety of kids and staff on campus? Why not spend a little bit of time reviewing and touching on that, making sure we have shorn up any loose ends and made sure that everybody is super clear on everything? That's only going to benefit everyone.
Vicki, I think Jenna had her hand up before you. Jenna, did you have a comment you wanted to make?
Yeah, thank you. So definitely like the rest of the board members, I'm very much in the middle ground on this, but representing the students, and advocating for their well-being, I think I am leaning more towards the side of returning to school, whether that be February 1st, February 8th, or if it takes us coming back week by week to reevaluate. But if we set out to say 2 more weeks, if we include winter break, that's a total of 2 months that our students have been out of school. And overall, this whole time in COVID, mental health has, been seriously struggling. And so if we continue to extend that time out of school, that is a fear of mine that, the negative effects of mental health and learning loss are going to start outweighing the negative effects of COVID that has on our students. So I am very much in the middle ground on it. And if we do decide to head back to school, I think we do need to take some time to reevaluate the information that's going out to our teachers, because like we've seen here tonight, there is some issues with that, and reevaluate the mask wearing and the social distancing, because as someone who has been on campus, I think it has not been perfect, and there's definitely room for improvement there. So I think that does need to be reevaluated. But keeping in mind that students do have the option to stay home from school, and before in our hybrid learning model, we had 0 reported cases transferred on campus. To advocate on behalf of the students, I am more in support of returning to school in this next upcoming month.
Thank you, Jenna. Vicki, Calhoun?
Yeah, I was just going to say, I heard what Lauren said about coming back weekly, but I think a 2-week would be more appropriate since we can see the trend more effectively. So I would think to come back on the 15th of February And because the numbers are still too high, and like she said, it was at a 12.9. And when we got on hybrid, when we got on distant, it was a 12. So I still don't see a major shift, but it is going down. So my suggestion is, and my concern is the safety and the welfare of our students as well as our teachers. But I still think that 2 weeks would be more appropriate at this time.
Thank you, Vicki.
Absolutely.
Joanne?
Thank you. The dashboard by the county, the one we're referring to, updates every Tuesday. It's a lag, and so in some sense that's good news. That it's improving. And we have a meeting scheduled 2 weeks from today, the 9th. But I am absolutely willing to come back every week on a Tuesday so we can see which way the trend is going. I agree that we need to have kids back on campus as soon as possible within the parameters. So we set out from the outset about safety for everyone involved. Safety, security, health, learning, they're all so closely intertwined. So I'd be perfectly willing to either come back next Tuesday or decide at our regularly scheduled meeting on the 9th. And I recognize that there have been studies done about kids in school and transmission, and there are many variables that don't always neatly apply to our situation. One thing that is certain, though, elementary age students are not as much of a vector for this disease as high school students are. High school students are, in fact, transmission in the same way that adults do, transmit in the same way adults do. And so looking at elementaries that are looking at our elementary districts that are, in fact, mostly elementary age students and having them go back earlier, there is some logic to that versus the potential for us not going back for another week or two or so on to make sure that we really are striking the right balance. And that's the challenge for all this. What is the right balance? And we're all struggling with it. I get my information not from media, but in terms of the statistics, I go straight to the source, which is the county. I'm not having it filter through media outlets, which may be incomplete or have a perspective. I just want to look at the data and apply my, educational training and ability to analyze and be able to say, okay, that's the raw data. What are the trends? We don't have a crystal ball, but we do know if you look at a trend that it's unlikely to have, a huge variance. So I'm like two of my other colleagues, I'm glad to come back every week, or we could wait till 2 weeks from tonight, which is our regularly scheduled meeting on the 9th.
Lauren Klatzker.
The other thing that I want to throw out that Joanne made me think about is that a lot of districts have opted to do phased reopening into hybrid. So different grade levels starting at different times. I know that like Buena Park, for example, is doing that. I know that the plan for reopening in Anaheim is also, for the high school district, is also a phased reopening based on grade level. So Los Al did the same thing where their elementaries were in, but their high school was not. They went back in tiers. So I think that there's something to be said for letting students come back at different times as well. So just because our feeder districts, like Joanne rightly pointed out, are coming back, and data does show that that younger students are less likely to get sick and to transmit, it makes sense for the high school students to return after they do, because they transmit like adults.
Dr. Stanley?
Yeah, there was an earlier question. Approximately 40% of our students are on the AB schedule, attending school. 60% are staying home.
And those 40% are the ones that want to be in school.
Correct.
Well, I think that says a lot about where the community is. The community at over 50%, at 60% is saying keeping children home is the right decision to make right now. So again, you know, how you phrase the data is important. Saying 40% want their kids to be in school, that's accurate, but 60% want their kids to be at home. So, you know, I think that's valuable information.
Well,
Thank you for getting that so quickly, Dr. Scambray. I appreciate that. I wasn't sure that was going to be possible at the drop of a hat.
No problem. We have that. Yeah. But we still have 40% of our parents who want the kids in class.
Well, that was 40% then. It's hard to really gauge what they want now. They might still all want to be back, or they might be interested in waiting a little longer. It's hard to determine with accuracy, though it is accurate that before we left, you know, 60% were staying home and 40% were on campus.
I think that's correct. And if we went back, it would probably go back with the same ABC configuration that we had in place previously, I guess.
Correct.
Yeah. Okay, I don't see a majority thinking that we should start next week. Unfortunately, because I think our kids are suffering. I don't know whether a week or coming back and doing the same exercise in a week is going to make any difference. I think we're all willing to do that because we want to do what's right for the students and our teachers and our other staff members. We could certainly arrange another meeting next week on a Tuesday, same time, if everyone's willing to do that. What do you think about that? I think the suggestion was, I think Dr. Jang said he would be willing to go back weekly and look at the data as it is at that moment and statistics, and then make a decision with maybe a goal of a 2 weeks from now opening, perhaps. I see two heads shaking yes. Joanne?
I like your perspective where you said the goal is to open. You know, that's the goal. Yeah, and you know, so we're looking at it each week like, all right, are we there? One thing to point out is that at the end of this week or beginning of next week, everyone anticipates that another vaccine will be reporting good phase 3 trials and potentially relatively quick, just like the other two, emergency use authorization. And that's the Johnson & Johnson vaccine, which is a 1-dose vaccine. So a week from now, that data may be out about their phase 3 trial. We might know more about when they could get conditional use authorization. They stated they're on track in terms of their manufacturing. So that may be a game changer even just a week from now. Not that they'd be in the arms immediately, but at least we'd have a better sense of what's happening with that aspect of our decision making.
I know we have a meeting on the 9th. I think we need to make a decision on the 9th as we make this really important decision on health and safety of our community, our students, and our teachers. So I would like to move it to the 9th.
That's 2 weeks from now, not 1 week, as was suggested previously.
Right, 9th, and then hopefully everything, the trend will go down and we can get them back in class on the 9th, on the 15th.
I think we should meet next week and see what it looks like. Last week, there's been a huge increase from last week to this week. And if that trend continues, then that gives everyone a week to prepare, to whether you're a student or a staff member, to prepare to return back to class. And like I said, I think it's fair for us as a board to come in every week and to look at that and to evaluate it, because that's how important this decision is.
Okay. Can we set that up, Dr. Scambray, for a meeting next Tuesday, which would be the 26th?
No, that would be February
5
2nd.
o'clock?
Oh, the second, excuse me, February 2nd.
Same time, guys?
Yes.
Yeah, is 5 o'clock good with everyone?
Yes.
Can I
Okay.
clarify for my minutes then, you're extending the distance learning schedule. Do you have a date that you're extending it to at this point, or are we waiting?
I believe what I heard the board saying was that they would reevaluate whether to return at the meeting on the 2nd of February, based on updated data, vaccine availability, etc. Am I saying it correctly, guys?
It might be, and I need to check with my colleagues, that our mindset right now is return on to hybrid on the 9th. The 8th
Right.
is a holiday.
Right.
Unless we see some, but we're going to discuss that next week to make sure that the trend is continuing in the way that makes it possible to reopen on the 9th. But I don't want to be putting words in my colleague's mouth, but that was kind of my feeling about it.
So you're saying set a 9th return date based upon what the results would be next Tuesday?
Correct. Though if that is not the will of my colleagues and I misunderstood, I'm flexible.
I agree with you.
I'm on the same page.
Chester?
Yes, I agree with you, Ann.
Okay, so the goal is to return on the 9th, but the decision will be made on February 2nd.
Okay, so I understand